Hi there. I wanted to come on this afternoon and talk about something that I've been seeing a lot this week. I have quite a few patients that have come in this week with vomiting and or diarrhea. And this is something that I am really excited to talk to you about as a general pediatrician and as a previous urgent care pediatrician, talking to families and counseling parents whose children are struggling with diarrhea. I have spent a lot of many years talking to parents about what do you do when your child has diarrhea, because there can be a lot of sticky situations. So diarrhea, more so than vomiting, can actually lead to electrolyte imbalances and actually a lot of fluid losses. And when that happens, infants, babies, and children can start to feel pretty tired and they feel pretty crummy because it turns out that you need your electrolytes to be in balance in order to feel okay. The other thing that can happen if they're not eating very much is they can actually, their blood glucose can drop a little bit too, which could actually lead to them feeling pretty crummy and pretty tired. But I really just kind of wanted to talk about what do you do to manage diarrhea at home? Because I have quite a few parents this week that are doing that with either infants or toddlers or school-age children. So I usually recommend that if your child's not eating very much, at least to make sure that they're getting fluids. And my fluid of choice, if your child's having diarrhea, is actually a product kind of like this. This is actually a Pedialyte freezer pop. You can actually find this in the supermarket. I think I got this at Safeway. It's a little bit salty. It's got electrolytes in it. It's got glucose and water volume. What's good about it, the glucose can actually help if your child's not eating very much and their blood glucose has dropped a little bit, and that might be why they're feeling crummy. This has got glucose in it. And the electrolytes, sodium and potassium, that can be lost when your child is having diarrhea. This can help replace it. The thing though is it's salty, so a lot of older children don't like the flavor of it, but if you cool it down in the form of a freezer pop or even just put it in the fridge, sometimes they tolerate it a little bit better. For toddlers, many times I'll recommend getting either the freezer pops or even just the liquid Pedialyte, putting it in the freezer for a little bit, letting it get kind of slushy, and then you can even just take a spoon and spoon feed it to your child. And sometimes that works. I did have a patient come in yesterday who had liquid Pedialyte, and her mom actually, at my suggestion, had brought in a little medication syringe. So when it's kind of salty and your child doesn't actually want to sit there and guzzle it down, you can actually get a medication syringe, fill this up with a little bit of Pedialyte, and then just syringe it between the cheek and the gum. And that gets some extra fluids in there until you can get in to see your doctor. So that's one little trick about getting the Pedialyte in. Again, I prefer this. If your child will only take water or only wants to breastfeed or take breast milk, that's fine, but try to get some electrolytes in, and that's where the Pedialyte comes in handy. It comes in a bunch of different flavors. I think there's a couple of other brands out there besides Pedialyte, but Pedialyte's what I know and love and usually recommend. Another thing that came up today, because I had a newborn that had some diarrhea, and we even talked about this yesterday with my patient that's having diarrhea, is an old nurse's trick that I learned as a resident at Nicholas Children's Hospital is to double diaper. So let's say your baby is in a size 1 and is having diarrhea and it's blowing out the sides and up the back. Even though the diaper fits the baby, you want to put an extra diaper over your baby's original baby diaper to kind of capture any extra that comes out. This could be a game changer for some of you, because if your baby has diarrhea in the middle of the night, it can spread all over the bed sheets and the baby, and it's a lot of cleanup. And if they're having multiple diarrheas, it's a lot of cleanup. So that's one trick that I have. And then the other one, my patient yesterday, her mom loved this one, is, so we call these chucks, we use them in the hospital and in medical practices to kind of clean up messes and to prevent things from, if a child's peeing or has diarrhea, it helps prevent transfer to other areas in the clinic. But you can actually use this over your baby's diapers, right? So you've got baby diaper, and you can actually put this is what we sent her home in. Actually, you can actually put this over it and then, just kind of zip up the onesie. Where these are also handy is for your car seat on the ride home from the doctor's office. If your child's still having diarrhea, you can actually use this in the car seat to prevent transfer of explosive diarrhea to your car seat, which we all know cleaning car seats is no fun. And if you only have one car seat and then you throw the car seat upholstery into the washer, you can only put it in the dryer for so long, and then you've got to like hang it out and dry and let it air dry, and that may take longer than you have time for, especially if you have to get to the doctor's office. So these are some little tips that I tell my patients when they come in and they're struggling with how do we manage the diarrhea at home. Of course, this isn't medical advice per se because I'm not necessarily your doctor, but this is ways to manage diarrhea when you're at home before you get in to see your doctor. It's kind of weird. It's a warmer than normal fall, and so I think that's why we're seeing a lot of like tummy bugs out there that are causing kids to have diarrhea. It's really kind of unseasonably warm here in Portland, Oregon, and usually when the weather warms up is when we see a lot of tummy bugs circulating. So we have same-day appointments today. If your child is sick out there, we have well child visits and availability tomorrow and next week. If you forgot to schedule that well child visit and you're tired of waiting for your appointment that's 3 or 4 months from now, give us a call at Pure Joy Pediatrics. We're always happy to help and see you.